Greetings, everyone. It's 5 p.m. Manila time, and I suggest we start this session. Welcome everyone to this session titled "The Role of Real-Time Evaluations in Influencing Decision-Making During COVID-19." This session is being led by the Islamic Development Bank Group as part of this year's edition of the Asian Evaluation Week. My name is Hamdi Ahmedou. I'll be your session's moderator. I am Senior Manager for Monitoring and Evaluation at the International Islamic Trade Finance Corporation, which is the trade solutions arm of the Islamic Development Bank Group. I'm really pleased and honored to be moderating today's session. Just before we begin, in case you have missed the introductory video, I just would like to share very quickly some technical notes. The chat function will be disabled for participants, but we welcome your questions under the Q&A tab, and we will do our best to make sure that they are comprehensively addressed. But as I am sharing these technical notes, I would like also to seize this opportunity to express my sincere gratitude to the organizers of the Asian Evaluation Week for giving us this opportunity to host this session. And obviously, I think specifically about the Asian Development Bank team, Marianne, Maria Consuelo, Connie, Sandra, really a big thanks. You've been working tirelessly over the past weeks so that we can meet today. You're doing a wonderful job for knowledge sharing, and thank you very much. So as I said, I'm honored to moderate this session with such an impressive panel that I will be introducing to you later. First, I would like just to briefly set the stage for our discussion and tell you about the rationale of the theme of the topic, real-time evaluations. After all, real-time evaluations are nothing new. They've been practiced over the past 20 years, particularly in the context of humanitarian projects. But they have evolved over the years. Their definition, their terminology have evolved over the years to meet the demands for accountability and learning in emergency context. And there is now increasing interest in learning from this experience to inform evaluations also in other areas, especially in development. And this interest has grown considerable since the COVID-19 pandemic. The response to mitigate the adverse impact of the virus has been global and at a scale never seen before. We've seen multilateral development banks approving multi-billion packages to respond COVID-19 response programs. And other multilateral institutions such as the UN agencies have also designed specific COVID response programs to respond to the immediate needs. In such a context, evaluation practitioners have encountered a new set of challenges, such as adapting traditional evaluation approaches, shifting to remote M&E approaches, and also providing real-time data and immediate feedback on ongoing interventions. The growing interest in RTE is maybe a reflection that traditional evaluation approaches, methods focused on credibility of evidence, independence, accountability, that are often time-consuming may not be adapted to a turbulent, uncertain, and rapidly changing world. We need evaluations that can provide evidence faster and cheaper and support adaptation and learning on interventions that are being designed as they are implemented. Now, are the RTEs really the solution for that? And what are the challenges they pose for evaluation practitioners? These are some of the questions that we will try to address during this session. We expect you to get insights from different concrete experiences in conducting evaluations of COVID-19 response programs by MDBs and multilateral organizations. And with that, I'm pleased to introduce you to our first speaker, our lead presenter, Amin Abdullahi. Amin has joined the Islamic Development Bank in 2015 and is currently working as a senior evaluation specialist in the operations evaluation department. He has about 15 years of experience covering project planning, monitoring, and evaluation with a specific interest in food security programs, focusing on rural development, poverty alleviation, and international development. At the Office of Evaluation, he led and contributed to several project evaluations, country assistance evaluations, program and thematic evaluations. And most notably, he was a key member of the evaluation of the real-time evaluation of the ISDB COVID-19 response. Amin is an IBDA-trained evaluator and holds master degrees in evaluation from Saarland University in Germany and development studies from Haramaya University in Ethiopia. Amin, thank you very much for joining us. It's a pleasure to have you, and the floor is yours.
Thank you so much, Hamdi, for the introduction, and good day to all. I'm delighted to be part of this distinguished panel. To start with the key takeaways of this session, the objective of the session, as Hamdi just explained, is to familiarize ourselves with RTEs, how do they work and how they are conducted, what are the main challenges associated with RTEs, and most importantly, how RTEs can narrow the gap and lead to better decision-making in times of crisis. I will provide the overall context and a bird's eye view of our first RTE experience in Islamic Development Bank. And then my colleagues will provide more practical examples. Next slide, please. Yes, so as it may be the first time for some of our participants to engage with the Islamic Development Bank, I thought it would be useful to quickly tell you about the Islamic Development Bank and also the Operations Evaluation Department. The Islamic Development Bank was established in 1975. It's one of the multilateral development banks. We have 57 member countries spread across Africa, Asia, Europe, and Latin America. And currently, the bank evolved to a bank group consisting of 6 entities, and each entity has different mandates from research and training in Islamic finance and economics to insurance, private sector development, trade financing, and poverty and alleviation. The evaluation function was established in 1991 with the prime responsibility of planning, designing, and conducting evaluations of the operations and policies of the Islamic Development Bank. We just finished our first real-time evaluation in the first quarter of this year, and I'll be explaining a little bit about it later on in the presentation. Next slide, please. So what is an RTE? As the name suggests, real-time evaluation is an early assessment of intervention in order to provide timely feedback that can serve as an immediate catalyst for operational improvement and mid-term or mid-course adjustments. Its broad objective is to gauge effectiveness and impact of interventions and to ensure that the findings of the evaluation is used as an immediate catalyst for improvement and change. To achieve this objective, RTEs are designed in such a way that it can provide immediate or real-time feedback to those planning and implementing projects and programs so that they can make the necessary improvements. RTEs are formative in nature and they seek to bridge the knowledge gap between monitoring and ex-post evaluations by focusing on the intermediate results. It also probes the early signs of progress and it identifies the strengths and weaknesses of program and intervention implementations. As Hamdi was saying, real-time evaluations were traditionally associated with emergency response operations. However, it has evolved over the years to meet the demands of accountability and learning in other areas, especially in development. Next slide, please. So when do we conduct RTEs? There are a number of situations that can necessitate the initiation of RTEs. And I think the first one is as a matter of principle, RTEs are carried out in the middle of implementation or during the early stage of an implementation of an intervention. And this is because it's at this early stage of implementation that RTEs have the greatest influence on operation, rather than waiting for the program to be completed, where nothing or less can be done to improve the situation. RTEs can also be initiated when a program or an intervention is about to enter a new phase or transition to a new phase. And for example, the real-time evaluation of the ISDB's response program to COVID-19 was conducted after the first phase of the program was about to be completed. And the purpose was to learn from the emerging lessons on the design and implementation of the first phase, so that it can inform the subsequent phases of the program. RTEs can also be conducted when there is an unexplained deterioration in the implementation performance. And in this case, RTEs are meant to identify implementation bottlenecks and suggest ways to improve them. Similarly, RTEs can be initiated where there is a change in the nature of an intervention. For example, if a development program is to be transitioned to relief operation in response to unforeseen emergencies. Finally, RTEs are often initiated to help with critical program decisions. For example, whether to decide whether to continue an intervention or scale it up, or even totally discontinue the intervention. That's why it's very critical for the findings of RTEs to be credible, accurate, and insightful. Next slide, please. So the evaluation criteria used in RTEs are the OECD DAC, or in the international evaluation criteria, are broadly appropriate for RTEs. However, the selection of the evaluation criteria would greatly depend on the methodology and the circumstances under which the RTE is conducted. Considering the fact that RTEs are formative in nature, the evaluations are normally based on tailored criteria, which includes relevance, efficiency, coherence, and to some extent effectiveness. As I said, RTEs are conducted at the early stage, so it would not be possible to fully assess the effectiveness of an intervention. So the focus here would be more on the level of outputs rather than outcomes. I would explain how we applied this methodology, evaluation criteria, later on in the presentation. Next slide, please. So RTEs, as we know, are generally participatory in nature because they hugely depend and rely on the interaction of the evaluation team with multiple stakeholders, including the intended beneficiaries. So a mixed methodology approach is more suitable for RTEs. There are a number of data collection tools and methods that are suitable for RTEs. The following are some of the most commonly used methods. Number one is desk review, and this is very useful for a better understanding of the evaluation context, and therefore a comprehensive desk review need to be conducted. The desk review would help in the assessment of relevance and coherence, and the main documents that can be reviewed include the project or program approval documents, financing agreements, disbursement reports, and if available, project or program progress reports. The second and most commonly used method is the key informants interview with internal and external stakeholders. And this is very useful not only in collecting data, but also in triangulating it. The discussions, the key informant interviews and discussions would serve as a source of opinion and insights on issues, on the lessons learned, on the challenge, and they would really help in identifying the implementation bottlenecks. This key informant interviews can also be done virtually when meeting the informants. Physically meeting the informants is not possible like it is in these days. Another important method is site visit and observation. Whenever the situation allows, it is really advised to visit the program site to directly observe the program outputs. And also it's during the site visits that we would have the opportunity to visit and meet and interview the end beneficiaries. Another method which we also applied is online surveys, and the survey was used to assess the perception of the stakeholders on the bank's the perception they have on the bank's service quality and responsiveness during the response program. And however, it should be noted that this method may not be suitable for meeting for the end beneficiaries because of the technological challenge. Next slide, please. Now on lessons and recommendations, generally it's not expected that RTEs provide formal and prescriptive recommendations for the management to action upon them. Rather, the focus is on using the evidence to draw lessons gleaned from the experience and identify opportunities for improvement, present thoughtful views, and offer high-level guidance rather than prescriptive recommendations. The reports, RT reports, should be intended to spark an internal discussion among the stakeholders and to propose a set of suggestions that provide a useful ground for the management to prepare management action plans for the way forward. Now, let me take you quickly through the RTE we conducted at the beginning of the year. Next slide, please. So the first RTE for ISDB was commissioned to assess the bank's strategic preparedness and response program, which is the IDB Group's response program to COVID-19. And the objective, as any other RTE, was to conduct an early assessment of the ongoing program and to provide timely feedback that can serve as an immediate catalyst for improvement. To give you a quick background on the ISDB response program, the SPRP, it had three components. The first component, we call it R1 or respond, and it focused on addressing the immediate emergency situation, focusing mainly on the health and food security sectors. The R2, which we call it restore, was designed to support the livelihood of the communities by providing a line of finance to SMEs and also engaging the private sector. So that was like the medium-term component of the program. And finally, we had the R3 or the restart. The last component was designed to improve the resilience of our member countries and also revive their economies after post-COVID-19. So the focus of the RTE was mainly on the SPRP portfolio. However, we looked at also non-SPRP portfolio that were initiated to address the COVID-19 challenge outside the scope of the SPRP. As I said earlier, our final report did not make any prescriptive recommendations. Rather, it identified areas of improvement, and it mainly focused on lessons. In this regard, we did not rate the performance of the program or the performance of the stakeholders. Next slide, please. Next slide, please. Yes, thank you. So as far as the evaluation criteria are concerned, we used the regular evaluation criteria, namely relevance, coherence, efficiency, and effectiveness. Like I said, for effectiveness, we only focused on the intermediary results. We did not assess effectiveness of the program because it was at the early stage of implementation. As part of relevance, we tried to also see the implementation modalities, the relevance of the implementation modalities of the program. And in addition, we added one additional criteria, which is the agility and responsiveness, to assess the extent to which the bank was prepared and also swiftly acted to address the challenge posed by the COVID-19. So these are basically the methodology, the evaluation criteria we used. As these are all familiar to all, I will not spend much time here. Next slide, please. So after a thorough deliberation and discussion with different stakeholders, we selected 4 countries, 4 IDB member countries for an in-depth analysis, and we selected Chad, Egypt, Maldives, and Senegal. And the main selection criteria we used, because the program was implemented in more than 28 member countries, we selected these 4 countries based on a set of criteria, which included the diversity of the portfolio in the country in terms of sector distribution and the presence of different IDB group entities. We also looked at the geographic distribution, the economic classification of the country, and also the fragility, because we know these factors would have impact on the implementation performance of the program. So the main purpose of the country case studies was to compare SPRP portfolio with the regular bank portfolio to check whether the implementation modalities that were put in place for the SPRP helped in speeding up the project implementation. And our findings show that the fast-track procedures and other implementation measures put in place were effective in accelerating project implementation at the country level. Next slide, please. So, as you know, RTEs are conducted in a very short time frame. For us, we completed the evaluation in 3 months, but we faced a number of challenges, which I would discuss in the next slide. Next slide, please. So there were a number of challenges associated with conducting the RTE, in addition to it being our first experience, our first try to doing the RTEs. Perhaps the most difficult challenge was time constraint. We were expected to complete the entire evaluation in 3 months, which we did. But this had a number of implications. Number one, it limited the time that was available to us for consultation with stakeholders, and particularly in the travel restrictions made it even more difficult to meet and discuss with the end beneficiaries. So one of the ways that can be used to address such a challenge is to rely, wherever possible, to rely on the support of field staff or local consultants. For our case, we relied heavily on alternative data collection tools, such as online surveys, virtual interviews, virtual focus group discussions, and etc. The second implication of the time constraint was because the RTE was commissioned in a very short notice. It was very difficult for us to find suitably experienced evaluators. And we started the headhunting, I think, in December, which was not an ideal time because of the Christmas break and the New Year festivity. And we really struggled to get an experienced evaluator for our RTE. But we were very lucky to get Rakesh on board. which really helped in finalizing the evaluation on time and in a very, very good quality. Another challenge that's associated with the time constraint was the lack of sufficient time to do proper validations. Unlike regular evaluations where you have time to share advanced drafts with the different stakeholders to get their views and validate the findings, this opportunity was not available for the RTE because the entire process 3 months, like I said. So what we did to address this challenge is we identified focal persons, ISDB groups and complex, and we established a continuous engagement with these focal persons. And this was really helpful, not only in validating our findings, but also in getting useful insights and information about the program implementation. The second challenge, which I'm sure everybody who would do RTE would face, was the collaboration and commitment of stakeholders. As RTEs are normally undertaken in early stages of implementation, the stakeholders are normally very busy. They face time constraints, and it would be difficult for the evaluation team to compete for their attention. And at times we had to wait for several days to get a response from colleagues implementing the program. Another challenge is data availability. The evaluation being formative in nature will not benefit from the full set of information that is normally available for summative evaluations. For example, the RTE did not benefit from the self-evaluation material that would normally be available for summative evaluations, such as project progress reports, project completion reports prepared internally by the program team. Another challenge is access to stakeholders. In addition to the time constraint, sometimes, like the situation we had, COVID, would limit our chances of meeting the beneficiaries and other stakeholders. And this would be very difficult to collect data from the stakeholders, to get their views, to have discussions, site visits. So this is another challenge that we faced. Next slide, please. So to conclude, I think timing of the RTE is very, very important because when we do RTEs timely, they can contribute to improving the performance by identifying implementation bottlenecks and provision of useful lessons that can be quickly taken up by the program team and improve the implementation performance. Number two, careful planning is very critical to ensure maximum stakeholder consultations. And as much as possible, it's important to achieve a balance between site visits to gather data from the end beneficiaries and interviewing the information-rich individuals, the project, or the program team, the political leaders, and other stakeholders. And finally, when access to stakeholders is limited, like in the case of COVID-19, we can consider using remote data collection tools and also rely on local consultants, local evaluation consultants. But using online or remote data collection tools has its own challenge because of the digital divide. Not everybody would have access to the internet or to the computers, particularly the end beneficiaries in rural parts of the world. So that's one challenge we need to anticipate, because such type of engagements are limited to the program administrators, the program team, who are normally based in the headquarters. I found a very useful material which was prepared by the Inter-American Development Bank on how to plan and conduct virtual consultations in the context of COVID-19. And this is something I recommend for the colleagues to go through if they get time. So let me stop here, and I'm looking forward to hearing from our distinguished panel. Back to you, Hamdi.
Thank you very much, Amin, for this great presentation. I think it's a great way to start our session, and I'm sure it will also trigger some interesting discussion among the panelists. We are already getting some questions from the Q&A. It's the first time ISDB conducted an RTA, and yet you did it in 3 months, which is quite impressive. We are a bit short of time, but I would like you to address a couple of questions that we have received from our participants. Mainly, I mean, there are a couple of questions related to the methodology. You mentioned a mixed methods approach, but maybe you focused mostly on the qualitative aspects of these methods. Can you elaborate more on the quantitative methods that you have used? And also, eventually, have you used big data mining, such as social media data mining, to garner beneficiary perceptions for your RTA?
Thank you, Hamdi. Let me take the first one. As far as the quantitative data is concerned, we only used the part of our assessment was to also assess the implementation modalities, and that's where we tried to use the online surveys, which was administered in the official language of the bank. We tried to get as much information as possible, and that's one of the methods we used to see how the beneficiaries view the implementation modalities of the SPRP program itself, and also the tools used for implementing the program. So that informed the ways we can improve the implementation tools. And I think Rakesh maybe would want to add on it later on. On how was, yes, so the management was very, very positively receptive of the findings of the evaluation. And I think one of the factors that was very critical in getting the buy-in of the management is we tried to demonstrate the value of the RTEs, and we had a significant number of discussions and meetings from the senior management to all the way to the program team in the field. I think we conducted more than 200, I think we met more than 270 staff in a short time. So, and we had a launching workshop where we brought all the senior management, the program team on board to get their views on the approach paper and the methodology. And the findings did not come as a surprise because we continuously engaged with the stakeholders to get their views, to validate our findings, to get more insights about the program. So we used a participatory approach, which I think helped in the buy-in of the management and also the staff.
Thank you. Thank you. Maybe just one last question. I mean, about the timeliness of the RTEs. I mean, I think there is a question, I mean, in terms of validity of preliminary findings and possible recommendations. I think you made it clear that there was no recommendations, but what if they becomes outdated in a rapidly changing situation?
So what we, I think timeliness is very, very important because, like I said, the timing of the RTE is critical. Otherwise, the recommendations would be outdated, like the colleague said, and there would be little time to act upon them. So as much as possible, I think our experience shows when you do them during the program implementation, particularly in the earlier phases of implementation, I think then that's where we can have the maximum impact on the performance of the program.
Thank you. I mean, I see many questions coming, but they're not specifically focused on ISDB evaluation. So maybe I suggest that they get addressed by the panel, and it's a good way for me actually to introduce you to our panel today. We have three panelists. The first panelist has more than 30 years of development experience, serving at both the World Bank Group and the African Development Bank. He served as the Evaluator General, Vice President at the African Development Bank from 2012 to 2018. Prior to this, he spent more than 25 years at the World Bank, where he held several senior positions, including Director of Strategy and Operations, Deputy Vice President, and Vice President of the World Bank Institute, where he led a team of 300 staff in reinventing the business model of the bank. Today, he is a partner and chief operating officer at the Centennial Group, a major consulting firm, where he's leading the work on reframing and strengthening the business model. Rakesh Nangia, welcome. We are really glad to have you with us today. I know it's 5 a.m. in Washington, and I'm extremely grateful to you for being with us today. Our second panelist is a senior evaluation in the World Food Programme Office of Evaluation. She oversees the Global and Synthesis Unit, which includes the management of complex policy and strategic evaluations, as well as synthesis. Prior to joining WFP, she worked for the Development Evaluation Unit at Global Affairs Canada and coordinated the MOPAN assessments in 2012 and 2013. She has over 25 years of field experience with WFP, UNICEF, and CARE Canada. She holds a master's degree from York University and a diploma in public policy and program evaluation. Deborah McWhiney, welcome. We are very happy to have you with us. And third, last but not least, our third panelist is a principal economist at the European Bank for Reconstruction and Development, EBRD, based in London. She co-leads the EBRD's COVID-19 response, evaluation assessment, and prior to joining evaluation, she worked for several years in the country's strategy and result management of EBRD. She also worked in the private sector as an investment banking analyst and holds a doctorate in economics from University College of London. She writes research papers on the topics of financial stability, bank performance, and bank resolution mechanisms. Natalia Krieg, I'm very happy to have you with us today. Thank you very much for joining us. So I have many questions I would like to ask to our panelists, especially after Amin's great presentation. But prior to that, and to make this also session as interactive as possible, I would like to ask our panelists eventually if they have a reaction, if they would like to react to the presentation made by Amin. Natalia, I see you.
Thank you, Hamdi. Thank you so much, Hamdi. That presentation was great. It's great in a position actually to comment on it now, although we have great question from the audience. Congratulations also on the completion of your evaluation report. You've done it very timely, and we're already learning a lot from you. I have a very quick practical question, probably because I'm one of the youngest on the panel. In terms of the OECD DAC criteria, I've noticed that you had tailored one of them and talked about agility and responsiveness. We here at EBRD decided to focus on coherence, efficiency, and coherence, efficiency, sorry, skip my red, and efficiency, coherence, and relevance. My apologies. So obviously wondering, how did you go about tailoring your evaluation criteria and manage to get that approved?
Yeah, thank you so much. I think in addition to the criteria you just mentioned, we added additional criteria, which is agility and responsiveness. And because we wanted, because of the nature of the program we were evaluating, it was an emergency response program. We wanted to assess the capacity of the bank to adapt its tools, procedures, instruments to meet the needs of the context of the emergency and how well it responded swiftly. And I think one of the ways we thought we can be of value to the project team or the program team was to identify the bottlenecks associated with the responsiveness and agility. So we tried to assess whether the tools and procedures that were developed to address, implement the SBRP were useful, how innovative they were, how the bank was ready to respond to a similar emergency in the future, and what can be learned from this experience. So basically, it was because of the nature of the evaluation, and we wanted to see whether there is a room for improvement when it comes to implementation and response to emergency situations in the future. Thank you.
Thank you, Amin. Thank you. I think it's interesting to note already that you may have similarities, but also different approaches in conducting this exercise. I think the evaluation criteria is one example, and I think maybe there are more. And that's why I can't wait to ask the question to our panelists, especially first Deborah. Deborah joined us from the WFP. WFP has a large experience in conducting evaluations in emergency contexts. We would like you to share with us your experience in evaluating WFP's response to COVID-19, and what are the emerging insights and lessons learned from this exercise.
Thank you so much, Hamdi, and greetings to everyone. It's really a pleasure to be part of the panel, and very well done, Amin, and I feel I'm humbled, in fact, by the introduction of other colleagues. So very, very pleased to have been invited. I will be just presenting some of the work that we've been doing to evaluate the COVID response in the World Food Programme. We don't have RTE in our title, but very much there are many, many similarities that I'd like to draw upon, and perhaps some of the challenges in common. But perhaps just to start with a little bit of a step back, for those of you that may not know that much about the World Food Programme, we are certainly, I think, one of the largest or larger UN agencies responsible for humanitarian response as well as development work. We have a dual mandate. I was looking at some figures from 2020, and there was an assistance given to over 115 million people last year, over 61 million women and girls, and 54 million men and boys. And one of the things that was for us as an evaluation office really challenging was looking at the World Food Programme's response to what was a global pandemic. I mean, we all know this, and I think the complexity and scope of the pandemic and the uncertainty of the pandemic as it was progressing and continues, in fact, to progress was really unique and a particular challenge. And at the same time, the World Food Programme was responding last year in 2020 to 16 level 2 and level 3 emergencies. So that was, something that was, really tested and stretched the capacity that we have across 84 different countries. Last year in 2020, we had a revenue of close to $9 billion. So this is just a huge response across a wide range of programs and operating environments. So it was within that context that we were thinking last year, as the pandemic initiated, how we would then evaluate the response. We have, as an evaluation office, we're following the evaluation policy, which was established in 2016 to 2021. We're currently actually finalizing a new policy at the moment. We are an independent office of evaluation, looking at credibility and making sure that our evaluations are useful. As it relates particularly to emergency responses, we have a clear coverage norm so that we actually have a requirement or a mandate to assess all corporate emergency responses. So when you look at the number that we have ongoing, the number of responses underway, it really does test our capacity. So what we do is we combine evaluations of corporate responses that we lead ourselves as the Office of Evaluation, but we also work in collaboration with other agencies that have a humanitarian mandate in the context of an interagency humanitarian evaluation mechanism. So we call that the IAHE. And that is a mechanism that's very formal, that's standardized and set up, and that we participate in as members of a task force. And decisions are made on any given year which IAHE countries and or themes will be undertaken for evaluation as part of that collective. So we balance the work we do as OEV of specific evaluations of emergency responses with the work that we do in partnership with others. So coming back to the response to the COVID pandemic, given a bit of that, those mechanisms that do exist and those options, we started thinking already, very soon after the pandemic hit. In Italy, where we're based, as many of you know, after the first onset in Asia, it was really Europe that got hit, and Italy was really very deeply affected by the pandemic. So very uniquely for us as a headquartered UN agency headquartered in Rome, we were both responding to a pandemic in a coordination manner, unlike the way we had usually would do it. If you have a country-specific pandemic or a regional emergency, you would have a regional country or regional mechanism. We had a headquarters-based mechanism here, of course, because it was global in nature. And this was at the same time that the pandemic was particularly affecting us working and living in Italy. So it was really very particular challenges that we were facing. Nevertheless, our Office of Evaluation initiated the process of thinking through how to respond, how to evaluate in June of last year. We decided to embark on, in fact, our director made the decision to embark on what we called a retrospective developmental evaluation. So very much having components that are similar to real-time evaluation in terms of not waiting until the end of a response, but very much working within the initial phases of response, lots of feedback loops and engagement with stakeholders, and feeding in lessons and evidence to key stakeholders throughout the evaluative process. Ours is not as short as the example that Amin presented, because in fact we are still just now in the reporting phase. However, there really are many, many similarities. And just to perhaps present a little bit on this developmental, retrospective developmental approach, as many of you probably know, Michael Quinn-Patton is the person who's written most on this approach. He was actually someone who was guiding us in this process. And really the approach is based on complexity theory and systems thinking. And it takes as a premise, not that you're evaluating a policy, a project, or even a coherent unit or evaluand, but rather that there is uncertainty in the world, in the response, and it really acknowledges it, that things are not linear. There's no sort of formal log frame. We're not looking to see if results are achieved as they were defined according to a logical framework, for example. But it's really looking at the fact that life is messy, that work that we do is based on certain capacities and existing policies, guidance, tools, systems, etc., but that things are constantly adapted. And so what we're trying to do is look at that adaptation and focus really on development rather than assessing improvements. And the key question is not, did it work, but how did things change? What was developed and what were the obstacles? So this was the approach that we took, which for us was quite innovative, and the first time that we had done this quite formally within the Office of Evaluation. Just to say one more piece, share some information about how we set this up. We looked at four key questions. So we built on a strategic evaluation that was looking at the capacity that WFP has to respond to emergencies. That strategic evaluation was completed in early 2020. So not to duplicate that, we really built on the findings and conclusions of that, and even the recommendations of that particular evaluation to then define questions that would continue to promote learning within the organization. So we looked firstly at how well a WFP fulfilled its role as a global partner in a collective humanitarian response, because the response to COVID, as you know, was very much a collective response. The second question related to the extent to which WFP's enabling environment was set up to respond to the demands of the pandemic. We also looked thirdly at how well WFP adapted its organizational capacities to respond to the demands of the crisis. And lastly, we did look to some extent, or are looking at the results that the response delivered from a both programmatic and organizational point of view. So we looked at everything from partnerships to emergency preparedness, strategic and management adaptation, guidance and communication that was provided from headquarters to people in the field, risk appetite and management, knowledge management, evidence and data. We looked at the financing, internal and external financing, workforce management, programmatic adaptation, and cross-cutting issues related particularly to gender protection, accountability to affected populations, and conflict sensitivity. So this was the work that we did. With each of these themes that I've just mentioned, we developed an evidence summary. These were shared with key stakeholders in a workshop format, and we had feedback that was provided to us on each of these topics. So we were able to fine-tune and validate the work and the thinking in each of those areas. And much like what was presented by Amin, we didn't have key recommendations. We had issues for consideration. And these issues were then picked up by these colleagues and used within their own learning processes. So we have been taking the learning that we've gathered thus far and feeding into various different fora, global operations task force meetings, staff retreats of our emergency department, briefings of our leadership group. So we continue to feed this information in, even though we are still not at the reporting phase yet. So I wanted just to present this. I have other elements that I could share, but I'll stop there and hand the floor back to you, Hamdi. Thank you.
Thank you, Deborah. That's very insightful. I mean, retrospective development evaluation, that's how you call it. It's very interesting to see the difference in terminology, but as you mentioned, there are also many similarities: stakeholder engagement, participatory approach, and also the focus on learning, which is one of the similar aspects we know. I would also like to hear from EBRD, which conducted also an evaluation, the Office of Evaluation of EBRD, which conducted an evaluation of their COVID response. And I wanted to ask Natalia, what were the main rationale and drivers for conducting such an evaluation? And what are the main lessons learned, and how did it affect the implementation of the EBRD's response program?
Thank you so much, Hamdi, and thank you so much, Deborah. Your experience it's great. It's really, we're learning from you. For us here at EBRD, it's the first time we're conducting rapid evaluation, and even on the definition, we also don't call it RTE. We call it interim assessment, and follow slightly different approach, which I will explain. Just briefly on EBRD, for those of you who may not know organization I'm representing here today, European Bank for Reconstruction and Development has been on the market for 30 years. We have public sector shareholders, but we support private sector in over 30 countries of operation. 1/3 of them is in Asia. So very much hope the audience question, which keep coming, will be obvious to those of you who are from the region. In terms of the COVID-19 response, our bank has been one of the first multinationals who supported their clients. We launched our package already in March 2020. The main focus of the package, without going into too much details, was to help clients with their short-term liquidity and working capital needs. We supported a wide range of clients and still continue to support. For the question, why have we done our evaluation and the main drivers and rationale for it, we were asked by our board of governance, who are the decision makers, to come up with some early findings and lessons, ahead of the annual meetings, which happened in June this year. So we started working under very aggressive timelines. Similarly to Amin, we have around 3 to 4 months to complete our early findings and continue with our sequential approach to our rapid evaluation. We came up with this because of the multinational community of our evaluators. We've seen so many questions actually popping in for the people we benefited. For example, Asian Development Bank has been great guiding us how to conduct rapid evaluation in the sequential approach. For example, we started with analyzing our data portfolio. Ongoing, we issue the data, which we'll be discussing later today, but most importantly, thinking also how to tackle the question we don't have the time to tackle right now and parking them for the future, but already collecting the data as we addressing different questions the Board of Governance expected us to answer. So we actually cut off the points for the annual meetings, preliminarily informally presented what we think, what we were already having cooked, and obviously ask for guidance for the next decision-making process, and already working on the next elements the board governance asked us to investigate. At the moment, EBRD is in a position when we're thinking about the future, the recovery phase. So we're very much as a strategic evaluation, we're trying to be forward-looking, focus on learning rather than accountability. And in terms of the OECD Act criteria, obviously in the full evaluation, which hopefully will come in the next year when COVID gets under control in our vast range of country operations, we will tried to cover as many of the DAC criteria as possible, talking more about impact, effectiveness, but at the moment we focus on relevance in terms of did the EBRD support gone to the countries, groups and sectors which were hardest hit, and the definition of the hardest hit is very tricky. We spoke extensively with the European investment banks on the definition issue. We're still discussing this with management, and we have a great relationship actually with them on trying to get the data which is not available and trying to come up with something holistic which everyone is satisfied with. On the coherence, internal, external, on the internal is again the strategic vision. Our board of governance and the management are working at a very high speed, almost like a highway, motorway, driving 800 miles per hour. And they're looking to us also for that, some indications of flags rather than recommendation, which we used to provide them with, where they're heading. So for example, we're in a position already to say that the obviously Building Back Better agenda for our bank is to focus on green and inclusion. We already seen the need for rescuing our clients with liquidity and resilience issue shifted us slightly away from where we should be heading for the greener economy agenda. I don't know any of you are interested. Obviously our economies are producing certain indicators which judge how far away are we from the transition gaps, and that's obviously to do with our mandate. We are here to support fully functioning market economies. So going back to the effectiveness criteria, I mean, obviously introduced in the presentations, the last one was efficiency. So for that one, we focus on the actual implementations. Did our bankers did the job quickly? Did the communication of our package has been well spread over the region? We all very much know that sometimes it's first serve first come basis, and we don't obviously want our clients not to receive the support they need because they don't know about support which is available for them. And lastly, on the effectiveness, we obviously at the moment now when the data becomes much more available are in a position to dig deeper on the effectiveness and link that with the strategic vision for our institution and be more forward looking rather than backward looking. And it's the first time we're doing this, so very much happy that you have us here on the panel also for learning rather than just sharing.
Thank you very much, Natalia. Very insightful. And I think it's the right time now to turn to Rakesh after hearing experiences from ISDB, from WFP, from EBRD. Maybe Rakesh can provide us with an external view on these experiences and tell us, I mean, if RTEs and rapid evaluation methods in general are effective tool to support evidence-informed action and to take corrective actions, and if you believe that RTEs and rapid evaluation methods are the right tools to address the complex dynamic systems, uncertainties and turbulence that characterize our disrupted world today.
Thank you, Hamdi, and first greetings to everybody. Thank you very much for allowing me this opportunity to be part of this panel. Truly honored and grateful for this opportunity. Let me first begin, Hamdi, by congratulating you and the Islamic Development Bank for really being the first out of the block, if you like, on doing an RTE. You started very early in the process as soon as you saw potential changes happening and the emergency response that was required of the multilateral development banks in the COVID crisis. And I thought that was truly unique in a sense of taking the plunge on your first RTE, if you like, and coming out fairly quickly in the response. The second thing I really liked was the complementarity of views from both Deborah and Natalia. The one thing that seems clear is that the name is less important. So whether we call it an RTE or a retrospective evaluation or other interim assessments, it is the key elements that are being picked by various agencies that seem appropriate. And I think that's really the smart approach going in, because there is no one size fits all. And this tool, in a sense, provides that flexibility and ability for each institution to pick what is really relevant for their purposes. I'm going to, perhaps, you have two loaded questions in there, and I'm going to try and see if I can bridge the gap through some examples. You mentioned, Hamdi, as did Deborah, that real-time evaluations are not new. They have been in place for the better part of 2 decades, and they started with humanitarian responses and emergency responses. And the reason, let's look at perhaps some of the rationale. Let's take the example of an earthquake. There is a team that goes in for an emergency response that is of different skill sets. So there is a team that is immediately looking to save lives by pulling out bodies from underneath the rubble, clearing the rubble, etc., and finding as many people and helping them out of the crisis. Simultaneously, there are others who are this food aid required, water, teams that are building up tents, etc. All of this is happening in a very short span of time. And before you know it, as soon as the crisis is over, let's say the team that was clearing the rubble, a week, 10 days later, they are gone. They are gone to their day jobs, and then the rest of the team continues until the crisis is over. So what was required was an immediate understanding of what is going on in the field, and not a summative evaluation in a situation like this provides very little, because the team is gone, they've forgotten, they've moved on to the next crisis and so on. So the important part is to catch them early in the process, learn from their deep understanding of the issues, and then move on to identifying what the key lessons were. And that was what Amin's presentation was also showing. You could view RTEs, or whatever name you would like to put in there, as a formative evaluation focused on outputs, perhaps at best interim outcomes, but really focusing on outputs and making it a learning experience. There are, as Amin mentioned, no ratings given, there is no recommendations, but really a true learning experience on going forward. And the same thing happened with COVID. It seems a distant past now, but let's keep in mind when the crisis was just starting, and you had exponential increase in the numbers of both the number of people contracting COVID, as well as the mortality rates, which continued to rise. It was a crisis of unbelievable proportions, which we had not seen for the last 100 years. And the questions that were coming up and emerging as we were, or as Amin was leading and finding out the preparation of all of these things, was very different from a typical evaluation. And it's interesting to note that because I'll digress a little, Amin mentioned something about quantitative data. What we found was that we can find some quantitative data, for instance, on the agility and responsiveness of the bank. The bank, the Islamic Development Bank, for instance, within a month of the WHO declaring it a pandemic, within 1 month, the Islamic Development Bank management had approval from their board on a strategic paper and directions, right? Now, a month means working pretty much 24/7 and finding the framework, which Amin mentioned, the R1, the R2, the R3 in there. And so the sorts of data that we were looking at was for each country that they were finding, how were they readjusting the existing portfolio to find resources for COVID activities. How quickly were the countries reacting to the crisis? There was a new model that was put in. How quickly were the countries then able to put in applications and so on? So there was quantitative data, yes. But more important than the quantitative data was the qualitative sources. And this, again, is part of the characteristic, let's say, of an RTE. The dependence is more on the qualitative data than on the quantitative side. But the two, obviously, when you're talking of mixed methods and so on, need to be finding an appropriate balance. Is it the right tool for the complex dynamics? Deborah rightly explained all the complexities within and the uncertainties within which we are living. I think as an effect, is it an effective tool? Is it the right tool? The answer would be it depends. And let me give you why I think it depends. First, it's the nature of the data and how much data is available and what the quality of the data is. The second is the speed with which a response is required. So when we're looking at an activity, it is not only a one-time shot. For instance, for a midterm review, you have a fair amount of time, but you also have some experience. You have interim indicators of targets and so on and so on. That does not exist here. But it doesn't mean that you need to do an RTE only once in the operation. You could do it multiple times in an effort to continually offer opportunities for correction and therefore meet the challenges on the outcomes. In the case of the COVID response and the RTE that Amin was leading, it was interesting to see that our initial challenge was not that of resources, but that of supply side. The supply chains had been disrupted. It did not matter how much money a government had. There were no ventilators available for purchase. The procurement systems internationally had failed because the focus of the limited supplies was to OECD countries. So those are the kinds of challenges that we found, and then the management of ISDB began to adjust based on that. And should we move more to R2 and R3 because of the time changes and so on and so on. So lots of interesting things, and that's what I mean by continuous corrective measures that can happen. The second thing that is the it depends part is the evidence base is likely not going to be perfect. As evaluators, we all like to pride ourselves on the rigor of our evaluative evidence base and how we come to conclusions and so on. This, as Deborah was mentioning, is really a life of uncertainty and inadequate information. There has to be a judgment call on when we have an appropriate balance between what we would be comfortable with in terms of making decisions in an imperfect world with inadequate or non-complete information, and then making that call and helping, saying these are the key issues we see, and then management has adequate information to make that call as well. So that's the second part of why it depends. And the third part is the rigor, and Deborah was mentioning about the process. Natalia was also, again, over the years, the evaluation community has developed processes which focus on the rigor, which focus on, and the rigor therefore helps on the quality side. All of us, I know, for instance, the World Food Programme has a very detailed quality assurance mechanism and so on, as do many other agencies, and that leads to the credibility. Now, if over time, the evaluation departments, the independent evaluation offices, have developed this sense of credibility and respect and so on with the management of the institution, the chances of this trust relationship and the suggestions or the findings of an RTE being accepted more openly because of that trust relationship and the inherent thinking that these guys are solid, they provide quality work and so on, is much higher. So rather than becoming defensive, the users of this information would be more open to rethinking and the corrective measures because of that trust relationship. So many factors go into it. The short answer is yes, it can be very effective, but it depends on many things, and therefore it can be an effective tool. It doesn't have to be called an RTE, but many other factors come into play.
Thank you very much, Rakesh. That's very insightful. I'm going to say we're a bit short of time. I would like maybe Deborah to react to Rakesh's answer and presentation. And tell us also from her perspective, I mean, even beyond the COVID-specific evaluation of the COVID-19 response, I mean, WFP have been conducting emergency evaluations, rapid evaluations, RTEs, for the past 20 years. And that was also what makes you distinct from the other MDBs. It's nothing new to you, but just based on your previous experience using RTEs in humanitarian context, can you just elaborate a bit more on the methodological challenges that you have faced and how you eventually have addressed them? And also, I mean, Rakesh said it very clearly, it's not about the name. You can call it retrospective evaluation, rapid assessment, but still I would like to and I'm sure the participant also would like to know why you called it a retrospective evaluation and not an RTE. There may be a reason for that. Thank you.
Thanks, Hamdi. It's true that the terminology, in a sense, may not matter, but it matters. There's a little bit, it matters to some extent. I mean, I think we have to be clear that, you know, assessments and reviews are different than evaluations. I think that's quite fundamental. Evaluations come with a set of, you know, clear criteria, quality assurance steps, and so on. And the structure and governance that initiates them. I think the independence factor is crucial. So I don't want to, you know, that's not the purpose to debate that. I think from that perspective as well, the work that we've done, and this is why I tried to trace it out that way, has been to evaluate corporate emergency responses. These have not been RTEs. We haven't defined them that way, haven't set them up that way. However, they have always been initiated while the emergency response was still underway. But they're formal evaluations in the sense that they have both formative and summative components. We look at criteria that are informed by humanitarian principles, so including coherence, coverage. We integrate gender protection and accountability principles. They're often very people-centered. So those are some of the ways in which we do our corporate emergency responses and also participate in the interagency humanitarian evaluations as well. This particular evaluation that we did of the COVID pandemic, or that we're still doing, it's retrospective in the sense that if it was purely developmental, we would need to be much more embedded in the decision-making structures within the organization, and in a sense, accompanying policymakers, decision makers, program designers, and feeding in evidence as an embedded part of the management, which we have not been. We've been looking slightly, you know, retrospectively, so looking backwards over the course of last year, really 2020, to see what had happened. But the developmental aspect of it is assuming a complexity and a systems approach. We're not taking a model, a project, a policy as our evaluand. We're looking very much at the way in which WFP developed and adapted and responded, and we're not coming with a formal judgment at the end. We are trying to present evidence back to them using evaluative approaches, using evaluative principles. So someone, I think, asked in the one of the questions in the Q&A, is it the same as feasibility assessment? Not really, because it's actually an evaluation, but looking at an ongoing process, ongoing series of adaptations. It's really looking at adaptation. That's the developmental approach. And there's a tool on the Better Evaluation site that looks at it. The title is RTE, but it's got a really helpful series of tables where it compares similarities and differences of these different types of approaches that perhaps we can share afterwards, because I think it's quite useful. The last thing, if I may just say that I wanted to throw this back to colleagues, is that because we were engaged with colleagues in the pandemic response while it was still very active, of all of those topics that I mentioned, of which there were 10 themes, we started off with workforce management. So in fact, the first people we were interviewing and engaging with were human resources officers who'd been working like night and day for months, often in their homes, managing their own professional response to COVID as a WFP employee with their, family responsibilities and obligations, often in series, dealing with grief on a personal level, dealing with stress and grief and trauma, actually on a professional level, and really often in very, very difficult circumstances. So we had to actually adopt a trauma-informed approach to interviews, because essentially the interviewers became conduits for massive amounts of grief and stress. And there had to be, because it was done remotely in a mobile environment, huge care had to be taken. And in fact, the evaluation team did very specific training for this. So I just wondered if others on the panel and perhaps even people listening to this session have had that experience. It was something that we do definitely in humanitarian response evaluations, typically face-to-face, where you have a very specific approach and care given to the interview. But because again, this was remote and very real and present in people's experience, there was really a huge amount of work needed to be thoughtful and careful with people's experiences. Over.
Thank you very much, Deborah. I mean, we're really running short of time, and I would like to give us enough time to the questions we're receiving from the participants. Natalia, you've told us about your experience, in in evaluating the COVID-19 response program of the EBRD, and a question which also comes from, from Rakesh and Deborah's points. Do you think we can still produce strong evidence despite time constraints, restricted access to the field, and limited resources? Is it even the objective of an RTE to produce strong evidence? And do you believe that RTEs then, in a certain way, undermine the credibility of an evaluation?
Many thanks, Hamdi. Let me maybe break the rules and touch on the things Deborah and Rakesh has been saying in their responses, because actually it builds up to the answer I would like to provide you with. So on Deborah's point about the approach to the interviews we have done and the quantitative versus qualitative pros and cons and trade-offs Rakesh has outlined, that was very much a challenge for us. Obviously, we start with the easy desk portfolio analysis, the quantitative side of the instruments, quickly realize that bankers are way too busy, and as Deborah has said, very stressed to help our clients to survive and cannot provide us with additional information which the systems already at place in the bank could not give us to us. So we shifted our approach towards and adapted to be more focused on the qualitative approach. We have very much shortened our structured our interview questions. Quite often they are very complex, but because of the short attention span, we make them very simplistic, so the bankers obviously can look at them. We also personalize the way to send those, rather to send them link to go online and fill in the questionnaire. We actually send them personalized emails, and I was one of the stakeholders receiving the responses in order to firstly receive a lot of interesting things which may have come beyond the question, and also make it more human and more personal, because obviously they're very busy. And also that provided us with additional information which again adapted our evaluation approach, and also as Rakesh was saying, make us more credible with our interaction with the management and board of governance, because the end users obviously are our clients, and by the information we collected through that survey, for example, which was 230 bankers who are in charge of our COVID-19 response program, were providing us with. And because those transactions are still ongoing, those things can then be used in implementation of our operational and make the adjustments which are necessary. To go back more specifically on whether the evaluation exercise is credible and so on, it's definitely new for us here in EBRD. We're learning a lot from all of you here today and also prior to the discussions, and we're actually seeing very positive things being spelled out. We're shifting from the accountability more towards learning, and also building culture of learning within our institutions. You haven't seen us present here before because we were too focused on the accountability, and now COVID has put us with demand to adapt our processes and go with the RTE or rapid evaluation for us and learn from it. So obviously the data issue Amin was explaining in his presentations for us was also a challenge. We couldn't put pressure on our stress staff to improve their processes in order to answer the questions we have in our evaluation questionnaires and so on. So therefore adaptation was the key for success. And we still very much believe it's looking at the board of governance who are happy with the feedback we're providing them with, that they like the approach of us coming back to them with the incomplete analysis, but still they are then able to tell us how to adjust in order to provide a better decision making for them at the end, who are the end users. So I just wanted to leave you with those reflections. And going back to the strong evidence, time constraints, access to field. Obviously, yes, we operate with 30 countries of operations. We couldn't go to the ground. We've done everything remotely. You make use of the digital platforms as much as possible. I've seen some questions, people asking about the use of social media feeds to provide some evaluation. Obviously, that's something for the future. There's only 2 lead evaluators for us working on this, so we didn't have the time to hire the consultant and deal with that. But that's actually a very interesting idea where Asian Development Bank has implemented. They read through the social media feeds on the perception of their COVID-19 response package and see how it is perceived by the public and obviously ultimately the clients. And that's very much something we hope to get the resources to do next, and obviously with more time to tackle that. And one more thing I think I wanted to mention, the evaluation, the past. So obviously we had to cut corners and not do all the evaluation diagnostics we should have been doing, but I think everyone understands that and cannot really criticize us that we're not talking about impact or effectiveness to full capacity in a holistic manner at this stage. But the sequential approach with the real-time evaluation really provides people and users to do that and continually learn as you're working on the path of evaluation.
Very good. Thank you very much, Natalia. Rakesh, we've just listened to Natalia telling us how important it is for their evaluation office to provide a timely feedback to their management. I would like to ask you, I mean, as a former evaluator general of the African Development Bank, I mean, also as a strong advocate for the independence of evaluation office, I mean, in a bit of a provocative way, I mean, do you think it's the role of independent evaluation offices to provide a timely feedback on ongoing interventions? I understand that this may not apply to institutions such as WFP, which had a different business model. But for MDBs, I mean, after all, we can say that formative evaluations, that's the role of the self-evaluation function, of an M&E function. Do you think that by having independent evaluation offices such as an EBRD or ISDB getting involved in such an exercise, do you think it undermines in a certain way their independence?
Good question, Hamdi. It's interesting because for the better part of 15 plus years, the multilateral development banks, for instance, I think it was really Bob Picciotto, who was one of the earlier heads of evaluation at the World Bank, who was really focused on strengthening independence. And so for the better part of 15 years, the evaluation offices have been working hard towards strengthening the independence, if you like. And if we look at some of the various components of independence, at least as articulated by the Evaluation Cooperation Group, it has a few elements. One, of course, is structural, so you're reporting to the board, etc., and not through management. The other is financial. The budget is determined by the Development Effectiveness Committee or the CODI rather than management. You have conflict of interest clauses and internal pressures, etc. So all of these are what I would consider necessary. But in the end, what matters really is behavioral independence. How independent is the head of evaluation and the staff? Or do they have any fears of speaking truth to power, if you like, and coming out with what their best judgment is? And I give this story because in the end, a lot will depend on that behavioral independence with respect to RTEs or any interim mechanisms. It also depends very much on the strength of the self-evaluation system that exists there. So self-evaluation systems, by definition, let's not forget, management is also keen to ensure development outcomes. So nobody's saying that the objective or the ultimate goal is any different. Management also, in the case of COVID or other responses, is keen to ensure that development outcomes are solid. So there is no doubting that everybody's in the same direction. And the traditional approach would be that because this is an ongoing program, independent evaluation should stay away, because at the end of the day, if, for instance, the Islamic Development Bank, once this COVID crisis is over, was to then do a summative evaluation of all this, they would find themselves in a little bit of a challenge, because They've already done an RTE, made some findings and so on, based on which management made some changes. And now they come back and say, well, things worked well or didn't work well. So there could be some conflict there. My feeling is that there is a level of understanding that all of us are part of the same institution. We're all pushing in the same direction, and the Independent Evaluation Office has as much a say in doing these interim evaluations and finding things. In the end, of course, midterm evaluations, for instance, are done almost always by management, but the Independent Evaluation Office comes in at a point in time, looks at a number of, a cluster of midterm adjustments done, and then comes out with an understanding and some lessons and recommendations on how that self-evaluation system can be strengthened. In the case of humanitarian agencies and so on, this may be easier to do because they are involved and engaged in that process of humanitarian aid and emergency responses and so on. Multilateral development banks, not so much. And so that could be one of the dichotomies. Yet on a personal level, I believe that the independent office should be engaged in this, even if it is a risk of a conflict later on, to be able to provide credible, reliable information to provide for that corrective measures taking place and hence improve development outcomes at every level. And the stronger the self-evaluation system, the less the need for independent evaluation offices to do that.
Thank you, Rakesh. We have only 5 minutes left, and we have, I think, many of the questions that I see have been, at least to a certain extent, addressed by the panelists. But maybe a couple of questions I would like panelists to address. One coming from Denis Ronald Okaya. He asked, what would you say about embedding or integrating environmental sustainability as part of the DAC criteria? Because of the fact that we're living in a turbulent situation with lots of emerging effects, including unintended ones. And I think maybe Deborah would like to address this question.
Mm-hmm.
I think it's a challenging one. As a, we actually at WFP follow the standardized OECD DAC and then humanitarian criteria. And there was, as many people probably know, a recent debate around potentially revising and renewing those criteria. In the end, there wasn't a huge amount of innovation. There was some clarification of definitions and the addition of coherence. I think that this is an area where there have to be sort of lenses and perspectives brought to evaluations, whether it's a gender lens, an equity lens, an inclusion lens, a disability lens, an environmental sustainability lens. And to some extent, it depends a bit on the organizational culture. It depends a little bit on the subject of the evaluation. It can even depend on the sort of experience and perspectives of the individual manager and or team leader, that kind of thing. So I can't really speak to that, the inclusion of the criteria, but I think there's no question that it can be included as a lens in many different ways. So there are no barriers in that sense, would be my answer to that.
Thank you, Deborah. Another question, I will maybe ask Natalia to address. Real-time evaluation give only primary outputs rather than outcomes. And how do you validate that such outputs are leading towards expected objectives? I think it was partially addressed, but maybe you can clarify.
Thank you so much, Hamid. Yeah, it's a very good question. Thank you so much for the person who asked that question. I forgot to mention at the beginning of my intervention that we've been very lucky that our management actually developed a results framework behind the COVID-19 response package. It consists of 57 indicators, and we were actively supporting them with drafting that and providing trusted advice, because obviously we have noticed very quickly they go with the outputs, and the outcome, short-term, long-term, leading to impact are not used too much, because obviously the issue will be, we will have to go to the client, collect the data, they are too busy with survival, that data would not come. Within the EBRD, we have quite robust way of collecting individual indicators from each individual projects. We have 450 projects under Solidarity Package as of today, the COVID-19 response package, and each of them has the attached indicators of outcome and outcome. So obviously with time that information will come. At the moment, when we pull the full download and look at the indicators that are due to be implemented, due to be monitored. So at the moment there are lacks, but still with the things we have, we can still say stories. For example, we have a very good team within the EBRD working on the SME, and SME as one of the major clients who needed our support during COVID. So obviously we have direct access to them. We can go and ask the questions and have much more insight. For example, have they received the groups which needed the vulnerable groups of women in business, for example, the youth, and so on, whether they actually received the help they needed from us. I see we're running out of time, so maybe I stop here.
We have 2 minutes left, and I would like just to give one last word to each one of the panelists. Just in 30 seconds, what will be your main takeaway, or how to wrap up this session? 30 seconds, Rakesh.
Always a challenge, but let's keep pushing forward.
Great. Deborah?
I think just to continue generating evidence and feeding back the evidence with to stakeholders and users, so active engagement and feedback loops.
Natalia?
Look outside of the box and focus more on learning than academic.
And Amin?
Try to engage with stakeholders as much as possible.
Thank you very much. And we're sorry for being short of time. It was a very insightful, I think, session. We wanted to had different perspectives from the moderator, from the panelists, and I hope it was insightful for you, for the participants. Thank you so much for being with us. Thank you to the panelists, to the organizers, and we look forward to further knowledge sharing opportunities. Thank you very much.
Thank you.
Thank you, Hamid. Bye-bye.
Bye.